I can imagine how much technology has to improve and how it's had to advance just to be able to support virtual care. So is there any chance you could kind of run us through any of these advancements? You know, how has technology had to adapt in order for virtual care to become prevalent and so important?
You're absolutely right. When people can't access the front door, the front door of care that they're used to, it's really accelerated the focus on what's increasingly referred to as the digital front door of healthcare. And so adapting or adopting new technologies has been critical. Now, some organizations, some institutions in some countries were really ahead of others in their adoption. And so when the pandemic hit, they were better prepared to, they were 6 steps ahead and they didn't have to implement the technology. They just had to better leverage the technology. And so virtual visits and telehealth preparedness, mostly big institutions were already down a path with that, and they just simply needed to handle the volume. Others had to both handle the influx of patients while implementing those new technologies, which again is that balance of your business versus your patient care that health systems always have to struggle with. What I think is interesting now is that we're starting to take a next step, in my opinion, around the maturity curve of using those technologies. So you can imagine in those early stages, particularly for organizations that were not as prepared ahead of time, they were using, like you and I are talking over Teams today, they were using Teams as a way of interacting with patients. And that's okay as an early adopter solution, but platforms like Teams or Zoom or others are only going to evolve and create better interfaces that take into account the medical record or what the patient is seeing and can be displayed. And so I think that where we started in an enabling phase of implementing new technology, now we're starting to think about, and I'm hearing customers think about, what's the experience for both the provider and the patient on the other side of the camera that they need to account for and think about and improve.